Thank you, Jerry, and thank you very much to our excellent panel this morning, which set us up for a great conversation with the people that I'm about to invite up here. In the interest of time, what we will try to do is seed ideas for you to pick up during the lunch session. So we will have 4 speakers today. One of them is joining us online. The other 3 are in the room. We will have some questions for them just to try and bring everything we've been hearing since yesterday about health evidence, air quality data, policy needs and policy requirements, and how do we really do that science policy interface? What is it going to take? And how can we make it happen? So first, I would like to invite and welcome Jane Akumu, who is joining us online. She's a program manager in the Sustainable Mobility Unit and really a leader and champion for clean vehicles. She's been working in this field for more than 20 years. So we are very interested in hearing her thoughts on the science policy interface. Next, I would like to welcome Dr. Gabriel Okello, who is the co-founder for African Center for Clean Air and also a research fellow at the University of Cambridge Institute for Sustainability and Leadership. He has been working on air pollution and related risk factors and their role in improving public health. So I think he has some good ideas and insights for us, hopefully. So Gabriel, if I can invite you to join us here. Next, I would like to invite Dr. Kiros Berhane, who is the Cynthia and Robert Citron, Rosalind and Leslie Goldstein Professor, a long name. He chairs the Department of Biostatistics at the Mailman School of Public Health at Columbia University and has been working on air pollution and environmental health for more than 2 decades. I think we learned yesterday he was John's postdoc 28 years ago. So lots of experience to tap into. Welcome, Kiros. And then finally, I would like to welcome Dr. Alex Diabakira, who's at the Kampala City Authority, an actual policymaker who can tell us what we need to be doing. So as I start with some opening questions for the panel, I would like you all to think about what you want to ask them. Anything that came up during the presentations that were made earlier today, things that came up yesterday, or other things that we may not have touched so far. And Kiros, I'll start with you. Again, in the interest of time, I will request all panelists to try and keep your responses to 2 to 3 minutes so we can have a conversation. And if someone says something that you want to respond to or add to, then please let us know, and we want this to be a conversation more than anything. So Kiros, based on your 30 plus years of experience doing scientific research, I'm sure in different contexts and in different places, you've seen health evidence and air quality evidence used for policy making, maybe in some cases abused for policy making. So can you tell us about any examples that come to your mind on where health evidence in particular may have influenced policy decisions, or it may have motivated actions on air quality, either in the US, where you've worked for a long time, or in this region or elsewhere in the world?
Yeah, thank you very much, Pallavi, and nice to be here. Yeah, so I think probably the best example in terms of best practices, because of my long-term involvement, I think would be from the US. Because there is a very well-oiled machinery in terms of, and a very rich legacy in terms of the framework set up, and a lot of science being done, but also the process of harnessing that science in order to inform policy, and then of course policy being enacted and implemented. Of course, as you said, there are probably many potential abuse or even missteps, but I think probably we can talk about the best practices. So before I give an example, in fact, I think it's probably a good idea to say a little bit about the process in the US, right? So we have the Clean Air Act, which was, I think, enacted in about 1970 and has been modified twice, at least, 1977 and 1990. And there is, it started with what the US EPA called the criteria pollutants with acts of Congress, including PM, which we have been talking about a lot today. And then under that mechanism, there is a US EPA Science Advisory Board, and there are also the CASAC, the Science Advisory committees, and many panels depending on which pollutant you're talking about. So under that mechanism, there is a very well set system, which probably I think we'll come back to later in your follow-up question for me, what we call this integrated science assessment. And in that process, there is a way of actually capturing what science has been telling us, how good the evidence is, how it informs the science, and how it kind of advances what standards have been set in the past. So that's done at the national level, but also at the state level. The US has, almost semi-independent and kind of autonomous states that have their own regulatory systems as well. And I worked in California for more than 20 years, 22 years, and the California Air Resources Board is actually one of the largest in the country in terms of implementing, evidence from science towards policy. So with that background, which I'll come back to later in detail in the follow-up question towards the end, maybe one example I can give is how science, informs policy, by taking the Southern California Children's Health Study that John mentioned yesterday as an example. So that was funded by the California Air Resources Board in, I think, early 90s, 1993, 94. And the whole idea was there was this suspicion, or at least belief, that ozone actually causes chronic effects on children's health, and therefore thousands of children were recruited, and they were followed, and the evidence showed a lot of things. But the concrete example I want to talk about is the one about impact of traffic. One of our publications showed that if a school is placed within 500 meters, or residence is within 500 meters of a major road or a highway, then there was a significant impact of air pollution exposure on children's health. And that was taken over up by the state and also by the local government. And there was, I think, a law that was passed. No new school could actually be sited or built within 500 meters of major road or highway. So that actually had a very, very immediate impact on policy. And I'm sure, as we have shown later on in our publications, children's health actually has improved because of those policies. I want to say, actually, HAI was actually one of the funders for what we call accountability study, to show that this research has, through a number of policies, many of them actually, so you cannot pinpoint one, but those series of policy actually showed that over a 20-year period where we have been following these children, as air cleaned up, the children's lung health actually improved, and the prevalence of what we call bronchitic symptoms actually also decreased. So that's actually an immediate evidence that science really informs policy. Policy, after it's enacted, protects public health. So I think that's probably a good example.
Yeah, thank you. That's a great example, and I know you're now working with a lot of scientists here to try and replicate a similar study. We'll hear a little bit about it in the afternoon. Also, if folks have questions or need more examples, I would suggest finding Kiros or John or Bob during lunch, because they've all been involved with the EPA process for a very long time. But I'll turn our attention to Jane now. And in the last 1.5 days, we've been hearing that we need patience, we need persistent engagement, and we need good data to back any policy action that we're supporting or that we want to see enacted. And Jane, in your sort of distinguished career over many years, I'm sure you've come across successful examples of policy actions taking shape, perhaps also needing evidence and persistence. So can you tell us a little bit about some of those?
Thank you, Pallavi. What I would say maybe patience. I think with good data and a good way of presenting that, I know policymakers are actually willing to take action quite fast. So I think that's what would be critical. How do you package that information? And a successful example I would give is lead elimination in Petrol in sub-Saharan Africa. So this, in 2002, the Partnership for Clean Fuels and Vehicles, which is hosted at TUNEP, was formed, from diverse partners. And the objective was to address increasing vehicle emissions in the developing world. So the focus was on the developing world. And the initial focus of this partnership was the elimination of lead in sub-Saharan Africa. By then, Sudan was one, Sudan and South Sudan. That was the only country that had eliminated lead in petrol. All the other 48 countries were using lead in petrol, and we already knew the evidence, the health impact of lead on health, and it was the main source of the ambient lead levels. So as UNEP, I would say we did two things, two studies in this case, one in Kenya and one in Ghana. In Ghana, we supported blood lead levels testing on diverse groups, on schools, schools that are along the highways, traffic police, and also staff in the refinery. And I would say that some of those results or findings were never published, especially the results in the refineries, and we know why. But that, the government really took action. Almost immediately, the government banned lead in petrol. We did a follow-up study in 3 years later, and there was significant reduction in blood lead levels. So I think it's quite important to show the evidence, from government action. What has that led? One more example in Kenya, apart from the blood lead levels, we also supported testing in the local vegetables, in kale and in milk. And this actually jolted the government to take action. I remember I was speaking to the PS Energy then, and when he saw the result, he was like, wow, what is this doing? We are eating this food. And that also made the government take action. I would say that we don't have to do studies in all the countries to take action. So with these two studies, we were able to go to the other countries, in the sub-region. And within a matter of less than 4 years, the whole sub-region, all the 48 countries that we're talking about, did eliminate lead in petrol. So that's the example that I would give.
Thank you, Jane. I think that's a pretty powerful example, knowing especially the kinds of impacts that lead can have on children's health in particular. And as you point out, we need good data and good information to try and influence policymakers. So Gabriel, I'll turn to you next. We know there have been ongoing actions around air quality. Different countries are trying to do things in their own way with the resources and the data they have. And you recently published a major assessment of the air quality management strategies from these different countries. So if for a minute we think about what can we learn from that, what are the lessons for us? Is health evidence relevant? How can it be relevant? So walk us through that a little bit.
Thank you very much, Pallavi. And I think, let me give a little bit of context about the study. So we were scoping strategies, air quality strategies that have been implemented in Africa, with a focus on what strategies are they, who was involved, was their effectiveness evaluated with these strategies, and what were some of the core benefits and unintended consequences of these strategies. So in trying to look at this, we were coming in from an angle of which, has just been said, you don't need to carry out studies in every country in order to implement some of these strategies. We wanted to provide a repository for strategies that have been implemented in different places on the continent, and then explore if those strategies can be applied in different areas and avoid reinventing of the wheel, especially given the current circumstances that air pollution is not the only problem within society, so whichever intervention that comes has to be really cost-effectively implemented, and we try to avoid time on trying to reinvent the wheel in some of these strategies. So in this, we actually found that 50% of the studies, about 48% to be exact, of the studies had not evaluated the impact on air pollution and health. But the 48%, the 52% did not evaluate, but the 48% that evaluated, we found that about only 14% evaluated health as part of the parameters for the studies. And the parameters that were evaluated included incidence of pneumonia, included inflammation of biomarkers, and then others were self-reported health attributes like reduction of chest pain, reduction of coughing as a result of implementation of the strategies. The most that we saw from this study was that most of the implementations looked at reduction of exposure of particulates, like PM2.5, PM10, carbon monoxide, etc. And that was about 77%. And only 3% looked at behavior change and practice as part of the biggest parameter within that implementation of the strategy. And I think this is very important. It's a very important study, especially for those who want to implement different strategies on the continent, as it will save you time. It not only provides those aspects, but also provides the core benefits of some strategies. As Alice mentioned in the morning, that, you know, air pollution, we have to take it in tandem with the development strategies of the countries and the communities. So it's quite important, as this point out, you know, some of the core benefits outside air pollution and health outcomes. For example, you know, increasing jobs, saving time on cooking, etc. Some of those core benefits that you can still explain to the various policymakers as you try to engage with them. And another key point with this is that they also provide some of the unintended consequences that were faced by early adopters in trying to implement some of the strategies. For example, difficulties that were found by people trying to implement biogas. You know, you don't need to kind of go through the same challenges if you already know what those people went through. Another important factor is that the early adopters are identified. So if you want to identify someone maybe was dealing in biogas, you have this information within a paper, and you just have to go and probably look at that paper, and you know who was involved in that section, and then you can probably contact them for the collaboration.
Great, that's a very quick summary of your very exhaustive paper. I think one quick follow-up is there an open sort of database of some sort that people can go to, or is it just the publication where you will find this information?
So you can find the information on in the publication. And one of the things I think now that you've mentioned that we can explore, for the supplementary files, we can share that with the Health Effects Institute, so that you put it on your recently developed database. So that makes it easier for people not only to access the paper, but also access the supplementary files.
Yeah, that would be wonderful. So in the last day and a half, we've heard about the need to get the information to the policymakers, to give the evidence to the policymakers, to help them understand what needs to be done. But Alex, from your point of view, as someone who looks at all of this information, the need for action, and then balancing everything else that you need to be doing, how do you see the role of data and evidence in setting policy priorities, or in bringing certain things up and down your priority list? And in the context of air quality, how has health and air quality data been relevant for making decisions?
Thank you so much for that question. You know that currently science drives practice, but it does that if it's answering the questions that the policymakers have that have no answers. Most times there are so many answers for questions that have not been asked. So no one needs those answers because it makes it very difficult. So there are answers if there has been a question that requires that answer. That's when research meets policy. But specifically in the context of air quality management, air pollution does not make sense if it's not looked at from the health effects angle. Because if something will not affect me as a person, we are the people, it is us, we are the creatures that govern the universe. Everything else moves on the decisions we make. Plants, animals, they all based on our decisions. So we feel that the priorities for driving the air pollution control agenda have to very strongly come out clearly on the aspect of what does pollution cause to health. whether it causes it to climate change or it results from climate change, if eventually it does not affect health, the human being is not going to give you a very good ear. Even if it affects crops and they have nothing to eat, if you don't connect hunger to health, they will still not understand it. So it becomes very easy to look at, for instance, air pollution being a very serious key risk factor for so many diseases, especially almost all non-communicable diseases, can be linked to air pollution, depending on the, on the agent that is causing the pollution. Is it mercury? Is it lead? Is it particulate matter? Is it something that can raise allergy so that you end up with strokes, with pulmonary infections, lower lung infections, some allergies, exacerbated asthma? When you come from that angle, then you can approach it from the idea of risk reduction. So if you're looking at a risk reduction approach, even World Health Organization will take it up very quickly because they want to reduce all risk factors for diseases, especially in sub-Saharan Africa where you have a double burden of disease. You have infections up there and you have non-communicable diseases also rising, meaning if we don't do anything, we will disappear. In the global north, they have non-communicable disease and infectious disease has gone down. Here in Kenya, we have both. So that's the only way. And then the other one is now the approach of risk communication. I think the health interventions globally have indicated that they know how to do behavior change communication. No one else does behavior change communication better than health experts. So if we want people to change behavior, and we are all aware that most of the causes of air pollution require behavior change, even if it is on the side of government, government is people. It is not building, it is run by people. So if you don't change the behavior of the people running government, we are wasting time. They're not going to make decisions in favor of pollution control. But also other things related, for instance, waste burning, which is an African behavior. Because we know that when you go to the fields deep inside Kenya, you're going to find people burning in the gardens. Why are they burning? These things can decompose and actually form manure. It's because this is a behavior. It's difficult to stop it unless you approach it from the behavior change angle. So we look at air pollution control strategies largely riding on behavior change. Whether it is government going to take a decision to be taken by an officer who needs to change his own mindset. If it is the community, it still needs to change behavior. And lastly, most of the strategies for control of air pollution can actually be evaluated and validated by looking at health data. Health data will actually tell you that you have achieved something in air pollution. Because people coming with asthma attacks will go down. Professor Lina and the health team will tell you that they are looking at how air pollution is connected to some health metrics, including asthmatic attacks, but also mortality. Because ultimately, it causes death. And most of the opening statements in this conference have been how many deaths are attributable to air pollution. So which means I can just measure death, and I tell you that your air pollution control messages and strategies are actually working very well. But also other interventions. So there are so many things from the health data that we can look at and say this country is making progress on air pollution, this country is worsening. Thank you.
Thank you so much for sharing those insights. And in a minute, I will come to all of you for any questions for the panel here. But Alex, since we have a captive audience of a lot of scientists here, do you have any questions that you think they need to be answering that they're not answering yet? They're looking for research ideas, so you have the floor.
No, for me, what I think and the approach we actually use in Uganda, and I keep saying this, most times it is the researcher to move to the policy. I think that needs to change, to move to the policy maker, if at all he exists. So if we get to a point where the policy maker also moves to the researcher, life becomes easier. The few times we have attempted to move to researchers, they are very welcome because they have been waiting for you to say this is what I need. So the policy makers need to make an effort to reach out to the researcher and say, I have a few questions here. Can this be answered? I've been to Professor Lin many times and he shares data. His team shares presentations. We look through and we guide, like we design a communication strategy. May not necessarily make a policy, but you need some small pieces of information here and there to just even be on a TV talk show if you're speaking to the public. So I feel that to be able to generate questions, the researchers have attempted, of course, definitely to move to policymakers, most times, of course, to disseminate what they have found, which I said earlier is not the question that the policymaker has. So you come with answers, and then those are not the answers the person is actually looking for. But the policymakers in the room, out there, need to also make an effort to present some of these requests to the researchers. And most times when you do, you either get an answer or they start looking for support to give you the answers.
Thank you. So any questions from the room for any of our panelists? Yep. I'll come to you.
Yeah, thank you, Pallavi. Actually, mine would perhaps be more of a comment, just to follow up to your last question to Alex and Alex's response. Last year, we had a stakeholder engagement meeting to talk about our research, and we invited loads of policymakers from ministries, etc. In fact, the Director General of NEMA, he's the one who opened the meeting for. Now, one of the things we asked was exactly that. How can we help you? What information would you require for us to develop? We got none. So, so that's a serious issue. We want to know from policymakers what they need. They can tell us what they need. But we do research and try to address what we think is required. And then maybe my good friend Alex will say, I didn't ask that question, so to speak. So it's a conundrum. Thank you.
I think I saw Salela looking at you, so probably she's going to find you during lunch to get to some of the questions.
Okay, thank you very much. I think, first let me inform you that I'm coming from Ethiopia. We've been evaluating the effectiveness of many environment-related policies in Ethiopia and the sub-Saharan Africa and others. And we found most of these environment-related policies, whether it is in Kenya or Uganda, wherever you go, in terms of effectiveness, they are much, much below the expected implementation. So do you think we have some problem in the formulation process, or what would be the probable reason for less effectiveness and even hated policies amongst other development partners? So your comments, please, how to resolve this issue.
Alex, would you like to start off?
Yes, I think I can give it a try, because first it starts generally from the formulation process. Most times we've had most countries, because we know that we look at WHO and US CDC or EPA based on what the problem is, and it's more of a copy-paste scenario. So you look at what WHO has said is supposed to be the cutoff for air quality, which is 5. Now you come to Uganda and say our cutoff is 5. Now remember, when you are looking at a policy, the effectiveness of a policy, or if it has been successful or not, you will measure yourself against 2 things. One is what you said you will achieve, you as the institution. Cinema, you said you want to achieve 5, which is what the WHO said you will achieve. When an auditor comes, they will measure you against what you said you would achieve. Have you achieved it, yes or no? What percentage? And of course, the other one is now against the international standards. So in scenarios where we are realistic enough, and we are also not funded and under funder pressure, because the funder throws targets at you and says, work with this. I want 100%, 100 people testing positive every month. That's what it is, and you have to look for those people. I've seen organizations in the communities testing to make sure they beat the deadline, the number. If they don't, they are performed below. But if you take a scenario that Jennifer, for instance, was describing here, you're informed by your own data, you've looked at it, you've monitored your air quality for 1 year, 2 years, you're realistically seeing what it is. maybe lockdown has come in, you've seen what you are able to achieve with the lockdown. You are not going to set the WHO standard and you say I can achieve this. Because even during lockdown, when everyone was not on the street, you didn't get what the WHO wants you to get. So why are you setting what the WHO wants you to do? Eventually, when you come as a researcher to assess, you're going to assess me against what I said I will do. And if I have not achieved, you will say I'm not effective, regardless of the efforts. So I feel it's either that direction, not informed by policy, I mean by data, because maybe it's not available or you don't have access to it. And then you also do copy-paste. You go to WHO, you say, they want me to make sure malaria burden is 20%. Our target is 20%. And then you cannot get there. Of course, there could be other things related to funding. I don't want to talk about funding because it is an African problem. So we don't usually say they are scarce resources. They are always scarce. But what do you do with those scarce resources to get where you want to get?
Yeah, just to add a little bit, from the researcher's point of view, but watching policymakers in action, I think there are three issues. One is, are the policies appropriate? Right? So it shouldn't be cut and paste. It should be context specific and context appropriate. So that's the big thing, actually. But even after you do that, is there a will to implement it? Because there will be a lot of resistance. If you're trying to reduce PM 2.5 to some level, there will be a lot of, hard decisions to make and painful decisions, which could be expensive. So industry and other bodies will fight it. So the will actually should be there. And then the third one is the ability to implement it, right? So I think enforcement is another mechanism. You can have the best rules in the books, but if you cannot enforce them, then they're going to be meaningless. And finally, the monitoring and evaluation process. So you have to show whether they have been effective, whether they have been implemented, and that actually feeds back into the system so that people have kind of respect and at least they take you as credible. You're not just passing laws, but you're actually impacting public health or welfare and things like that. So unless all those are fulfilled, I think the system will fail, right?
Yeah, maybe just to add on, something onto what Kiros and Alex have said. I think the other thing also we need to be careful about is how have you involved the communities where you're going to implement these strategies? How is there any sort of awareness that has been there while developing these policies? How involved are they? It may not be practical to ask everyone, but these communities have leaders, either cultural leaders or elected leaders, who can kind of represent generally what is going on within the local context. I think that is also very important. Sometimes some policies are passed and you're like, really? Did those guys, was the community ever even consulted? You just know it won't work from the beginning. And I think one more thing which is quite important, that some of these policies and programs, they are set up in good faith and with good intentions. But one of the things which we sometimes forget is that societies also evolve from time to time. And that brings in Kiros's point of continuous monitoring and evaluation, because a policy might be really relevant now, maybe to community X, and then 2 years later or 5 years later, it might not really be relevant due to some changes within the society. So the continuous monitoring and evaluation and seeing whether these are still applicable is really quite critical.
Jane?
Yes, maybe just to also add on to that, I would say that is quite a good question, because we've seen a lot, as UNEP, we've worked with the countries, we've worked with the sub-regions to, implement standards, and it is regional and country-led. For example, we've worked with the West Africa sub-region ECOWAS, the 15 countries, to harmonize their fuels and vehicle emission standards. And they're not very strict standards, but very good to start with the health benefits. So with the adoption of Euro 4 equivalent fuels and vehicles. And these were adopted in Europe in 2005. So they're not very strict, but it's a good start for health. And it took years, actually, maybe like 5 years to sensitize the sub-region and to agree. And they were adopted. I think one of the main challenges, I would say, would be commitment, government commitment, Some countries, a few countries have implemented this standard, which was supposed to be effective 2021. But I would say there's a lot of interference, and especially in some cases, private sector who still want to gain, to benefit, and trying to work with government to delay the implementation of these standards. So that is a big challenge that we see. And then the other challenge, I would say, the two. So one is the government willingness and commitment, which is led by, maybe some financial interest from some private sector. The second thing I would say maybe the need for awareness creation, because, when we were working with the sub-region on implementing, for example, Euro 4 emission standards as a minimum for vehicles being imported into the sub-region, and these are old vehicles, as we say, these are vehicles over 15 years. There's a lot of resistance. A lot of the countries were still saying it would be costly. So they need to package to show, the health effects of, having polluting vehicles versus having some regulations in place. I think it's quite important to, for this information to come out to the public so that they are supportive of some of the policies that are being proposed by governments or sub-regions.
Thank you, Jane. I think I'll just add also that, a lot of these policy changes take a lot of time. So we look at the US right now and we say, look, they've done so much, but we have to go back and count how many years it took them to get to that stage. So I think if we keep persisting and committing to action, hopefully in the next 10 years we will see more tangible change that we've seen in other parts of the world. We have 2 questions in the back here, so we'll take those.
Yeah, not a question, just a quick comment. I always hear a lot of concerns about the WHO guidelines. And I just wanted to say that, first of all, of course, they're not a government, they don't regulate countries. But also those guidelines are set based on, for public health, benefit of public health. We actually had we had a lengthy debate around this as well, whether doing the standards for Uganda. So I think the idea is not that we just get WHO and then implement them, or not look at it in that context, but rather look at that as the end goal. That's the ideal. And then when we're setting our standards, it should be like a pathway to like the ideal. And I think that's why we have interim standards, interim figures, interim guideline figures to lead us towards what's ideal. But I think we also, of course, should not default to set the standards because we can meet them, then defeats the purpose. At the end of the day, we are moving towards the ideal, not to say WHO is dictating for us, and I think there are always those concerns, because I know 5 is, nobody will meet 5, no one will, but I think if you're deliberate in putting in place measures, we can move closer to getting to that ideal that has been already established based on scientific evidence. Thank you.
Thank you, Deo. And I'll just make more plugs for who you should talk to during lunch about the air quality guidelines. We have 2 people who were in the guidelines development committee, Karadi and John, and I think John wants to make a comment, so do find them to ask why 5.
So I'm going to make a few comments and a few historical comments as the oldest person in the room, unless somebody wants to argue with me. So just to comment on the WHO guidelines, because I was involved in both of the last sets of guidelines, the 5 actually comes from the epidemiological studies, and it's the lowest level at which there is not an observed effect, essentially. And so it's a safety guideline. It's arguably not achievable, but it's there. And when we did the last set of guidelines, it was 2005, to come to 10, it was actually Kirk Smith who said, saying a guideline should be 10 is useless because it's so hard to achieve that for so much of the world. And that's where the interim targets came from in 2005. Just one other point for frustrated researchers who say, no one pays attention to my research, and I'll put myself in that group very often. If you look at what happened in the US, there were critical studies that made a difference in how the standards changed. And so if you go back, the PM 2.5 standard was promulgated, put forth in 1997, it started. The science that changed that was actually two things. The daily time series studies that a number of us did, and then some of the long-term studies, and you may have heard of the so-called 6 Cities study, and then also the American Cancer Society studies. And what these studies said was that air pollution was still killing people, which is kind of a reason to lower the standard, right? So that is what changed things. And then the standard continued to drop because these studies, I'll include the Children's Health Study as an important one, continued to show effects. So there were studies that you can put your finger on that changed everybody's thinking. And I think what you have to think about as researchers is, if you're doing a study just like the last study, it's probably not going to make a difference. And I think that's where the dialogue as you plan a study between policymakers and researchers may be important. What is it that will actually make a difference? And I think that has to be in mind. I actually, when we mentioned the Children's Health Study, which was launched in about 91 or 92, was at the original planning workshop. And I tried to engage the policymakers in a discussion about what the study should address, and they actually didn't understand what I was asking. So I think the alignment to get the right research done, the conversations should take place. And admittedly, we all have our self-interest. If you're researchers, you want to publish papers, become famous, and get promoted. It's good things to do, but then still the work has to make a difference. I'm happy to have the lunchtime discussion about the WHO guidelines and talk a little bit more about where they came from. And they are evidence-based. There are these very large systematic reviews that support them. So I'm done.
Thank you, John, for that perspective. I will take the final 3 questions because I know we have to get people to lunch. So I'll take all of the questions together and then ask the panelists.
Okay, actually, mine is just a comment maybe to reinforce what Alex was saying, that the active communication and engagement between the 3 triad players, the policymakers, the community, and researchers, makes it easier for policy uptake, because then, it becomes a back and forth idea. And also personal communication, personal connections also are very important. If Alex comes to my office or I visit him and we have coffee together, we actually can drive the agenda. The only thing that sometimes happens is that from a different study of a different perspective that we participated in, researchers were more of the view that, okay, we even look for our own money, we finance projects, and we try to do reviews and build the agenda, but the only challenge is that if the policymakers don't come for these results, they are out there, and they should actually look for this evidence. So some researchers, are divided. Should I even go a further step to look for policymakers, or actually they can, it's all available, on the net. So, of course, on the other hand, it's quite important that it should be much more proud of a researcher to make sure that the results are shared and used. That's when you can truly achieve. So I think that's important, that it should be that triad connection between the community, who are the users, the researchers, and policymakers. It eases uptake of the recommendations. Thank you.
Thank you, Lynn.
Okay, thanks. I think the partnership, as Professor Lynn has put it, becomes key. I can remember right from the beginning when you're trying to design the GeoHealth kind of project, going to various kind of players, right from planning grant, identifying what were some of the issues that perhaps could be of importance. So this thing of partnership, it's not new. It has been there. There were gaps, yes. There have been gaps all through, and people have tried to learn from that. by the fact that you are able to identify, let's say, air quality, particularly PM 2.5 in the geohealth, was very much informed, I would say, by both the existing data and also by what, let's say, the policymakers would be telling us, directly, let's say, engaging in NEMA. So I would say it is not a lost cause. We are actually in the right direction. We shouldn't be hitting ourselves too hard. In any case, the the level of 5 we are talking about, PM 2.5, it looks, yes, very tough. We have been explained to, Jonas explained it well, why it has to be. Just like 100% is explained all of us too well, why it is the perfect percentage. But even we know that even in the degree qualification, even 70% is first class. So we shouldn't be hitting ourselves too hard. When I'm, for instance, doing an evaluation, I would be keen to check, yes, where was I? Where am I now? Where do I want to be? How logical is it? Well, okay, where do I want to be in the next, let's say, 5, 10, 20 years? I would be keen to set the 5 level as, let's say, the next 20, 30 years. But doing an evaluation after 10 years, I would be keen not to hit myself too hard, thinking that I'm supposed to be at that 5, when ideally, maybe I could have moved from, let's say, the level the which we are told by Kampala of around 50 to 40. I think I should pat myself on the back for making that achievement. So I think we sometimes try to hit ourselves too hard. We think we are actually doing nothing, but these things are progressive. What is important for us is every other time, let's assess critically the impacts of what you have actually done within a given kind of time. What you call the M&D framework should be very, very clear. 100%, you are supposed to get it, but you know it's almost near impossible. Not even the cleverest would get it anyway. So if you want to use it, it's either 0 or 1, and you want to look at it that 98% you are still at 0, I think you are missing the point. Then for policymakers, I think maybe the other thing, yes, I think we have worked very, very well together, but larger, not in Kenya alone, but in many other countries. I would be keen to check, yes, what am I targeting? Or what is in the place, even putting aside the researchers, what data is in place and how can it help me achieve what I'm supposed to achieve? So there's already a lot that is in place even for the researchers. So I really would actually encourage that kind of partnership, but let's not hit ourselves too hard. Just do your best. John has actually put it well. Publishing is important, but it should impact the human being.
Thank you so much. I think in the interest of time, I'm going to ask if there were other questions to hold them for lunch. I do have a few just to bring us back to closure on this session. And I think what you're saying, Ofolo, is really tied to what I want to ask the panel here. So Kiros, if I can start with you. Selela mentioned that Kenya is currently reviewing their air quality standards. We've just heard a very vibrant discussion on the WHO guidelines, how they can be useful. We know there is a lot of evidence out there on health effects of air pollution, not just globally, but also some in the East African region. So what are some opportunities for us to think about the use and application of the health evidence to help inform the decision making that NEMA needs to do for the country and perhaps also inform the larger bloc?
Yeah, so thanks for that question. Actually, I think there are many mechanisms. The WHO one is one, and I think there are others like the European system, IARC, and others. But probably I would resort back to the US system because I know it more, but also I think it's one of the most effective ones. It doesn't mean that countries like Kenya have to replicate that, because that could be a very time-consuming process, maybe even expensive, not achievable. Mm-hmm. But there is a lot of science from the rest of the world that Kenya and other sub-Saharan African countries can benefit from. But there are some really best practices in terms of how to go about it. In the US EPA system, there is this integrated science assessment process that is actually very well laid out process in terms of, first of all, canvassing the literature for relevant studies that have already been done, and hopefully they have been informed by the dialogue with the policymakers to begin with, or by conscientious, scientists that actually would like to have impactful research, right? So the literature search, and then there is a long process in study selection. Again, in the African setting, probably I think reviewing everything might be the best thing to do, because not a blessing, but blessing in disguise in terms of you're not choosing from tens of thousands of studies. So I think probably looking at everything is good, but not all studies are created equal. Mm-hmm. So there will be actually evaluation of these individual studies, whether starting from the design, the way the analysis was done, the way the conclusion was inferred, all those issues need to be evaluated. And there is a very well laid system in terms of how to rank, not numerically, but at least conceptually, what the quality of these individual studies is. And then how to synthesize the evidence has also its own science, which I think should be followed. And then finally, I think, some sort of causal determination process. I think in the US there are 5 categories. There could be solid evidence about causality, or there could be no evidence, and everything in between. In fact, I was part of a committee very recently in the National Academies where this thing was actually reassessed, whether it is effective or it should be revised. For the most part, actually stood the test of time, and it was actually maintained. So I think we need to have that kind of process, or at least some portion of it, in the Kenyan and other sub-Saharan African system, in order to really reach at the right conclusion based on the best science available. So I don't know whether I have answered your question in the right way, but yeah.
I think you did. I think you laid out some good examples of how this could be done. And Jane, if I can turn to you next. Throughout this morning, we heard about the need to integrate air quality action into sectoral policies and sectoral interventions. And I think transportation is a really good example. It came up in the presentations from both NEMAs here. It came up in Dr. Kaudia's presentation as well. So if we think about transportation as a sector, where do you see the best intersections in taking into account air pollution, taking into account energy decisions, health, et cetera? And how can we continue to make progress using data and information?
Thank you, Pallavi, for that question. But before I answer, I would maybe just comment on, there was the discussion on what are the questions the policymakers are asking to the scientists. Mm-hmm. I would say, I think it goes both ways. I remember in 2018, we had a workshop here on Clean Africa Mobility, a week of various discussions, bringing various African countries, 40-something African countries. And we did introduce the issue of electric mobility. And at that time, almost all the African countries were saying, this is the technology of the future. It's not for us now, Africa is not ready. And, a few years now, we see almost many African countries now wanting to introduce electric mobility. So I think researchers can also shape, with providing policymakers with what are the emerging issues and what are the issues that should be considered. On your question, I would say maybe, addressing one, definitely we need to have sector-specific actions when it comes to air quality, because that's where we'll have an impact. And when it comes to transportation, I'll give one example. For example, soot-free buses. The governments, most of the cities in Africa are talking about having bus rapid transit, to improve mobility, sustainable mobility. But, we've also been talking of how do you also integrate cleaner buses, soot-free buses into these BRT systems. And, in these cases, we have, clear wins for improved mobility or sustainable mobility, having improved air quality, having improved health, and especially when linking these BRTs with the non-motorized transport, walking and cycling, because, you'll need to also link that. So there are clear wins when it comes to linking, sectors with air quality and health, and I would say they are just win-win solutions. Then the second, I would say, is on regional integration. The need for having regional solutions, I think, is quite critical. Thank you.
Thank you very much, Jane. That was very helpful. Gabriel, if I can turn to you next, I think you're one of the people who I would say is sort of in that science policy interface. You're doing research, but you're also working with regulatory agencies. And it certainly looks like there's a lot of different initiatives underway, whether they are under air quality, or they're under mobility or other sectors. So from your point of view, where do you see the best windows of opportunity to use the available data we have to generate new data so that we can be making policies that will bring lasting change?
Thanks, Pallavi. I think some of the best windows of opportunities are at, one of them is at the inception of projects or programs. And this is quite important because then you can bring out avenues of where the data can really impact on the program or impact on the policy. The other I would look at is that policymakers and governments have programs that operate in 5-year cycles, 10-year cycles, and there are periods where these are reviewed. So even the times of review, that's very important for data to be kind of introduced. But also looking at from the research point of view, you have to be pragmatic and